Hi friends, I'm Dr. Dattaram. I'm a consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. So today I'm going to talk about another common medical and surgical emergency in the abdomen, that is acute pancreatitis. Most of you would have heard about pancreas, which is a very vital digestive organ in the upper abdomen. Basically, pancreas has two functions. An exocrine function, it secretes pancreatic juice rich in enzymes which are helpful in digesting all components of food. It also has endocrine function, which means it secretes hormones, mainly insulin and glucagon, which, as you all know, help in regulating blood sugars. These are the two main functions of pancreas. It is a very soft gland. It extends from the right side of the abdomen to the left side of the abdomen and crosses the midline. It is very close to the spine in the deep inside the upper abdomen. Diseases of the pancreas compared to other gastrointestinal problems are slightly less common but more problematic. Pancreas is a very flesh-like organ, very vital organ. But whatever be the disease of pancreas, there are serious problems, among which acute pancreatitis is one serious life-threatening problem and very common. So what is this acute pancreatitis? Acute pancreatitis is nothing but an inflammation of the pancreas which is triggered by activation of the pancreatic enzymes within the pancreas. Most common triggers for acute pancreatitis are alcohol intake. Irrespective of the amount of alcohol you take, no amount of alcohol is safe. So irrespective of the amount of alcohol you take, that can lead to acute pancreatitis. Very commonly I have seen youngsters after a binge of alcohol during their bachelor parties or during weekend parties, they drink alcohol and the next day they'll end up in the hospital. So it's a very, very serious problem. So acute, they have severe abdominal pain. So the second most common trigger for acute pancreatitis is gallstones. So this is more common in women because the incidence of gallstones is higher in women. So generally if you see the profile, alcoholic pancreatitis in India at least is more common in men, whereas gallstone pancreatitis is more common in women. So these two are the most important or the most common triggers for acute pancreatitis. Other less common causes of what we see in children is trauma, that is injury to the upper abdomen. Children, when they start learning their bicycle or when they start learning the bike, so they get handlebar injuries. The cycle handle or the bike handle hits the upper abdomen. Pancreas gets crushed between the spine and the handle, a bike handle. That's called traumatic pancreatitis. And it's very common to see this traumatic pancreatitis in children. Even a steering wheel impact to the upper abdomen during a car accident can also cause acute pancreatitis. Yet another common cause is iatrogenic, that is post-ERCP induced pancreatitis. Patients who are having high triglycerides, they also are prone to develop acute pancreatitis. Some triglyceride level of more than 500 is known to cause acute pancreatitis. With very high calcium, serum calcium, patients with parathyroid adenomas or tumors or hyperplasia of the parathyroids, they are known to develop acute pancreatitis. They actually present with acute pancreatitis. Another important cause is drug-induced acute pancreatitis. Most commonly offended drugs are azathioprine. What I see in clinical practice, azathioprine started as an immunosuppressant for patients who are having arthritis or organ transplant or inflammatory bowel disease. These are the few common patients taking azathioprine who come to us with acute pancreatitis. So these are the few common cause of acute pancreatitis. Most of them, more than 90% of them, are either alcohol induced or gallstone induced. It is very sad to see when a youngster who has partying with his friends during the weekend or during the bachelor party, so they come with severe acute pancreatitis and land up in the hospital and ICU. So why does this acute pancreatitis happen? So acute pancreatitis happens due to autodigestion of the pancreas or activation of the pancreatic enzymes within the pancreas. So normally these pancreatic enzymes, they are stored as zymogens. They are inactive enzymes. They are stored as zymogens, and when they enter the intestine, they are activated by the small enzymes within the intestinal wall. That will activate them. The enzymes get activated and digest the food. So due to some reason, when these enzymes get activated within the cells of the pancreas, within the acinar cells of the pancreas where they are produced, they cause autodigestion of the pancreas and induce severe inflammatory response, severe inflammation of the gland, and sometimes this is the inflammation is overwhelms the system's immunity, and the patient can land up in severe problems. So the most majority of them will have a mild attack. More than 90-95% of them will have a mild attack, and they recover very well with supportive care. But there are a group of patients, at least 5 to 10% of them, they become very serious. So the main problem is there is fluid loss after acute pancreatitis, and they come in a state of shock. Majority of them develop multi-organ failure, and the first to get affected is the kidneys. So they get acute renal failure, they get lung injuries, they get something called as ARDS, acute respiratory distress syndrome. They are not able to breathe. Due to fluid loss and capillary leak, they come in a state of shock. The BP is sometimes not recordable. Not only that, the kidney starts failing. These complications of acute pancreatitis are very many in the acute stage. Some patients do develop something called as necrotizing pancreatitis. So this is a dangerous form of pancreatitis. Pancreas and the fat around the pancreas gets necrosed, that is the tissue death. So when this pancreatic tissue and the extra pancreatic tissue gets necrosed, then these patients are going to land up in serious problems, because the necrotic tissue gets infected in few days time, and this infected necrosis is going to cause severe problems. The necrosis needs to be treated with antibiotics. They are in the ICU for a long time. They need high-end antibiotic, broad spectrum antibiotics. Sometimes the infections are multi-drug resistant infections, which are very difficult to treat, and usually many of them require some or the other intervention in the form of a percutaneous drainage or a minimally invasive necrosectomy, that is removal of the dead tissue, or surgery for that matter. So they'll have a very bad outcomes. So the overall necrotizing pancreatitis as one of the deadly disease, one of the most life-threatening complication of acute pancreatitis, that is infected pancreatic necrosis. The idea of talking about this topic was to create awareness among people about pancreatic problems, that is acute pancreatitis and necrotizing pancreatitis. It is my responsibility to give a message to the people that alcohol is not good. So alcohol, especially youngsters, with a lot of pain deep in my heart, I really feel bad when these youngsters they land up in the ICU. I have seen many patients with a trivial quarrel with the wife, they have taken alcohol and they have succumbed to it. Bachelor parties, they have taken alcohol and landed in the ICU. I have seen patients dying after that. So this is the kind of patients I see, especially alcohol-induced pancreatitis. So I would say that stop drinking alcohol. The only treatment, the only thing which can save you from pancreatitis is not drinking alcohol. Patients with gastro pancreatitis, I would say, as majority of them are having acute pancreatitis, the first and foremost thing is to undergo laparoscopic cholecystectomy in the same admission if you have mild acute pancreatitis. Other things, patients who are having high triglycerides, you consult your cardiologist or a physician and get your triglycerides treated. Patients with high calcium, get your evaluation by an endocrine surgeon or a physician. Get those parathyroid adenomas, the hyperplasia, get treated by surgery. Treatment for acute pancreatitis is supportive care. Majority of them will recover. More than 90% will have mild pancreatitis, and all that they need is supportive care in the form of IV fluid resuscitation. Generally, this condition cannot be treated on OPD basis. You please get admitted to the hospital if you have acute pancreatitis for a few days until you recover. So with supportive care, when you nil by mouth and you are not allowed to take anything orally for a few days, with IV fluids and painkillers, majority of them will recover. The treatment of acute pancreatitis is only supportive. The most important thing is the fluid resuscitation. Rush to the hospital if you have severe abdominal pain. Get it evaluated. If it is pancreatitis, then get hospitalized. So patients who are having severe pancreatitis in the form of an organ failure or a lot of fluid collections in the abdomen, or who develop necrotizing pancreatitis, are very likely to stay in the hospital for a long time with high-end ICU care, intensive care, antibiotic therapy and interventions. So I am Dr. Dattaram. I am a consultant surgical gastroenterologist and laparoscopic surgeon, GI HPV surgeon practicing in Hyderabad. So patients who are having pancreatic problems can approach me on 9895437059.